Welcome back to Health Talks, where we bring real stories and experts' insights that make healthcare easy to understand. Today's guest is Dr. Asfiya Muhammed Ilyas, a specialist endodontist with a passion for patient education and pain free dentistry. She is also the founder of MediCore Academy, a platform where helping medical and dental professionals bridge the gap between theory and real practice. Let's dive into root canal myths, dental care tips, and the story behind MediCore Academy with Dr. Asfiya Muhammad Ilyas. So, welcome to the show, doctor.
Thank you, Shahnaz, for having me on the show. It's a pleasure having you here, and I'm
Great.
looking forward to talk about many things.
So, let's quickly dive into the passion you have for your career and your businesswoman and things and all. So, what made you start Medicore Academy or the first place?
So, yes, my first passion has always been dentistry. So, the first 5 years of undergrad, I have to give it to my teachers
Mm.
who inculcated the practice and the passion towards dentistry into myself. And after that, I should be very honest with you that I have met very good mentors as dentist who have given me the chance to explore different
Mm.
pathways. So that is the reason which has inculcated this kind of fire for me to get into entrepreneurship and as
Okay.
well as practice as well.
Okay. So, how, Medicore Academy, what was the major idea behind it? Because you could have started a dentist center, dental center, or you could have done any other thing. Why Medicore Academy? What was your major skill behind that?
Okay, this also goes back to my PG days. That was a time when I was in the UK. I
Okay.
had I just died from my private practice in India
Okay.
to my PG specialist practice in the
Mm-hmm.
UK, and I saw that there was a huge gap between the knowledge
Okay.
between India and the UK.
Mm.
Not in terms of patient care. I mean, obviously, all Indian dentists are equally as talented and as good as the other dentist as well. But there was a good amount of gap which was between the Asian dentist
Mm-hmm.
and the UK. That you can, why I'm saying Asian is because Asia and the European countries, we still, there is a disparity between
Mm.
them in terms of what do you call it as journal publication, research, and other things. And wherever you go, especially here, Asians, they take a back seat when it comes
Mm.
to Americans and the Europeans. So I thought that since we have the exposure towards both the cultures, why not we bridge the gap between the two?
Okay.
There are certain gaps which have to be addressed, and that can be done by somebody who has seen both the sides of the coins. So that's
Okay.
when I thought, okay, let's do this.
That's a very thoughtful progress, I guess.
Oh, thank you.
So, your specialization in endodontics, what drew you towards this field? Mainly, like people misunderstand about root canal treatments and a lot of other issues they face it. But how you, as a specialist, encourage them to like identify what is their exact issue and how you rectify it?
See, as when you come towards dentistry as a
Mm.
field itself, the general public, if I have to say, they have a very misunderstood notion that dentistry is painful and costly. But I have to tell you, dentistry is not costly and not painful as well if it is addressed at the right moment. It is the neglect what we do to our
Mm.
teeth, what we give our teeth, which leads to pain and price.
Okay.
So when you have a problem, come first to the dentist. Don't go to the pharmacist to take painkiller medicines.
Okay.
Just come to the dentist, identify the problem, and go ahead with what the dentist is telling you.
Okay.
So once a patient comes to your office with some problem, the and you can see that they are having the paranoia of dentistry and
Mm.
a dentist, the
Mm.
birds and the dental drills and everything, there's not much you can do apart from talking them through the treatment,
Mm.
giving them the exact thing what you're going to do. There
Okay.
is sometimes you can do a tell show do technique, like if they're really anxious, like
Mm.
telling them, showing them what you are doing.
Okay.
Usually that is much more than enough for them to settle down. And I think that builds in the confidence, the way
Okay.
how you talk. and some patients are ready to go ahead with what you are telling.
Okay. So, as a common practice, what happens is like when any patient gets any issues in their dental, usually people have this fear of visiting it at first because of the drilling and painful procedures and things and all. So, how you want to educate the people that that is the first step to like solving the issue by visiting a doctor only you can solve that issue. Neglecting that and prolongivity will increase the pain, more suffering will happen. So how you want to educate that?
That is something which is very difficult to do, because the paranoia and the anxiety what a person faces, we don't know why exactly it is there, so you have to address the root cause of the anxiety what they're feeling. Maybe they had a previous bad examples or experience which has a deep seated fear inside them, so address that first. So that will be the main step for them to come to you. So
Okay.
once they come, then it is already halfway done.
Mm.
You just have to bring the patients there. Then
Okay.
after that, you have to educate them, tell them what exactly it is. I feel like you have to walk through the whole treatment process with patient, like from the start, when they come inside the reception to you, what exactly you're going to do.
Okay.
With taking the the examination, then the x-rays, everything has to be explained to the dentist. With the new era of AI and everything, the patients are already well informed of what exactly is going on, though it need not be correct, but they know something. So you have to give them the confidence that whatever they know is not wrong, but what you have to put it in such a way that you don't put them down, but you
Okay.
give them the confidence that you can treat them better.
So since we can understand you are not only a dental professional, you own your business as well, you are an entrepreneur. So how this is filling the gaps? Like you are working somewhere, you are practicing, as well as you have patients, as well as you are running this business, as well as you are having a family. So as a woman entrepreneur, as a specialist, how you find it like good, bad, how you are doing it?
Okay, honestly, it is very difficult because I am juggling between my family with two very small kids, and then my practice, and also the MediCore Academy, which is also a little baby of mine right now. But when you have a very good support system in your house and your family, then I think it is easier for you to do it. So basically, that is the start point of every woman's success: getting the right support from your family, be it your spouse, your parents, your in laws, everyone. If they are understanding and if they want you to succeed, then I think there's no stopping you.
So, one piece of advice, if you would give like the younger generation, for the kids mainly, as a parent, you have to take care and follow as a daily routine, one routine
Daily routine for kids, like what age?
for dental.
Dental, small kids, limit your sugar, limit the junk. And the first and foremost thing, every 6 months, please visit your dentist. And for small children who are having their primary teeth, which is there, I would suggest them to visit every 6 months, because there are something called as pits and fissures in your primary molars. So there are chances of the child to get caries in there. So there
Okay.
are certain treatments called as pit and fissure sealants, which are very necessary, I feel, as a dentist for the for the small kids. So I suggest every other parents to get it done.
Okay.
Yeah, and also it depends on wherever you are, fluoride treatment for the child. That's also a good enough practice which you have to do. It's all for the betterment of the kids.
Okay. So, and one more question about root canal. Root canal, when we search as a patient, you know, as an Asian, whatever happens, we usually go and search in Google and things like
Yes,
that.
of course.
So it shows a lot of negative things about getting a root canal treatment. So what is the one myth you want to bust about root canal treatment?
That it is painful. It is not painful at all, because we give you a local anesthesia which will numb your pain. I wouldn't say that it is completely uncomfortable. You will feel uncomfortable because obviously we're drilling inside your tooth and there are nerve endings there. But the uncomfortable feeling that you get is because of the drilling which we are doing, but not because of the pain. So if you feel that you're gonna be getting the pain, then I would tell all our listeners that no, it's not painful.
Okay. So when the time of like we get aged and things like that. So what is the one advice you will give for the people who are above 50 or above 60? How they can take care of their oral health to maintain it without having multiple procedures or anything to like to go through any painful
Mm-hmm.
situation. So how you would say that?
When you're above 50, for me, every other person, be it a child or a geriatric patient, I would suggest everyone to visit your dentist
Mm,
every 6 months. And if you are having any issues, like you
mm,
have done quite a bit of filling or you have bridges,
mm.
other things in your mouth, then every 3 months, visit your dentist. Even if
Okay.
you do not have any pain,
Mm,
go and get your teeth cleaned.
mm.
Scaling is very important. You should not let the calculus build up, especially when you are aged like 50 plus, because that leads to gum recession and mobility of the teeth. So you have to take care of
Mm,
that as well.
mm,
And that is the age when we have to think about all the systemic diseases which the patient might have, like
mm.
hypertension, diabetes, and other things, which
Okay.
can also play a major role in
Mm.
dental treatment and
Okay.
whatever about the health of the teeth. So yes, visit your dentist every 3 months. So that's the bottom
Okay.
line.
Okay. And also my question about like MediCore Academy. So how you are filling the gap between the theory and the practical experiences with using this academy? How you are filling the gap?
Okay, so MediCore Academy, we are basically focusing more on the dental professionals. You know, every other field, be it medical, I'm not just being specific to medical and dentistry, every other field, it is constantly evolving. So, just because we have finished our degrees and we have started practicing, I feel we should not keep doing the same thing. I mean, there isn't this isn't the time to remain stagnant, you know.
Mm,
So you have to evolve yourself, get yourself knowing everything. You have to know everything that's going on in the market,
mm,
what is the new procedures and the new things that are coming up. So when you have a lot of professionals who are ready to
mm,
bridge this gap, you know,
mm.
there are so many academicians who want to teach others.
Okay.
So, and there are many students
Mm,
as a dentist who want to learn them, but they don't know how to get together. So we are working as a bridge between them. So
mm.
getting the academicians and the clinicians together with the clinicians and the students who want to evolve themselves and
Okay.
to learn further.
Mm,
So this will make you evolve your practice and upscale your
mm,
skills and your practice, which would definitely benefit in your patients.
okay.
Ultimately, the patients are the
Mm,
ones who are going to get benefited,
okay.
and we're getting benefited because of
Okay.
the
Okay.
patients.
So we are at the end of the podcast.
Okay.
So I have a rapid fire round for you. It's a surprise round for you. We
Yeah.
have not
Okay.
told you yet.
Okay.
So I'll be asking you certain questions and I want a one line answer with a very fast way.
Okay.
Okay. So let's start. Okay. So one dental myth which you wish you would disappear forever.
That dentistry is costly. It's not.
Root canal or extraction? Which one do you secretly enjoy doing more?
Obviously, root canals.
The first thing you tell a nervous patient in the chair.
Relax. It's not going to be painful.
One habit everyone should adapt for better oral health.
Visiting your dentist regularly.
What is harder for you, treating patients or managing students at MediCore Academy?
Treating patients.
So, if you were not a dentist, what do you think you would have become today?
I was going to become an architect. I mean, I was going to do that before getting into dentistry. So
Okay.
maybe I would have been building buildings rather than building the teeth right now.
One word that best describes your journey so far.
Learning. I have learned a lot through this journey. And I think I'll be keep learning many things.
That's great.
Yeah.
So at MediCore, since it's an academy and you are coming up with a lot of courses and things and all. So is there any recently coming up any courses you are planning to launch, and if you can explain that to us and how it's gonna benefit to what kind of people?
Yes, we are. There are a good lineup of courses which we have planned and curated according to different specialities. MediCore Academy, it's not just a dental academy, it is a learning platform for all the medical and the dental and the allied fields as well. So we have one that's coming up is we have mastering crown preparation
Mm.
and crown cutting
Mm.
techniques. It's an online course, and it is mentored by a very good prosthodontist from India, and we're doing that as an online course. And
Okay.
then we have a hands-on course
Mhm.
of airway management. I'm very excited about this
Okay.
because it is one of a kind, which is being done in UAE,
Okay.
and I have to say it is one of the first courses which has been accredited by the Royal College of Surgeons England,
Okay.
and it is being head by the head of Department of Anesthesia from the King's College London Dubai Hospital. So we have very highly qualified physicians who are
Okay.
heading the course,
Hmm.
and this is for emergency specialist and then specialist anesthetist and other residents who are here in we are aiming towards the doctors who are in
Mm.
Dubai, Northern Emirates, and Abu Dhabi as well. So yes, that is something which is very interesting, and we have a good lineup of courses which is coming next
Mm.
year. So I would want everyone to keep a eye out for it.
That's great. That's
Okay.
wonderful.
Thank you.
So I guess like that's the end of our podcast, and we had a very insightful session with you today, doctor, about dental and about your business and how you handle this and things and all. I hope people who would have been watching this podcast would have got an idea that dental is not a painful procedure if you go to the right person.
That's right. Yes. Thank you so much. I mean, I had a blast today talking to you. So yes, dentistry is not very painful. It's just that neglecting your teeth is painful.
Okay.
So, my advice to everyone is like if you think that you have a painful teeth or something, don't wait just till the pain becomes unbearable. So, in that is the time when it becomes costly, painful,
Okay.
and you start fearing the treatment.
Mhm.
You address the issue at the right time, at the right moment, then it's not painful.
Thank you. Thank you so much, doctor. Thank you for your time and sharing all the knowledge you possess. Thank you for that.
Thank you so much. Thank you so much for getting me here and having me talk about everything. I mean, I really am very happy to be a part of this.
Thank you so
Thank you
much.
so much.
Thank you.